Now to a sweeping review into mental health care for young people in Nova Scotia. The review was brought on after Rehtaeh Parsons' family complained that her clothing was removed with male workers watching while she was in the hospital. In April, she took her own life after a photo of her allegedly being sexually assaulted was circulated. The CBC's Elizabeth Chu is live with more. Elizabeth.
Amy, Rehtaeh's father, Glenn Canning, says he was worried that he would be disappointed by this report, just like he was of a similar review into the school system and how it failed Rehtaeh. However, he says he likes what he sees in this report. Glenn Canning says this is an uplifting day that's bringing a big change in mental health care.
It's something now that's been going to be addressed, and it'll be changed, and it's going to be a positive change.
Sparked by his daughter's care at the IWK, outlined in these hospital records.
They wrote down what Rehtaeh was happening, and stripped and see her naked, taking off her clothes.
In April 2012, the 16-year-old was being treated in the acute psychiatric unit, 4 South, for suicidal thoughts. Rehtaeh Parsons told her family she'd been raped and photographed. Months after the alleged attack, her clothing was being forcibly removed by hospital workers, worried she'd strangle herself with it.
What are those men doing here? They just want to see me naked.
Now a report by Dr. Jana Davidson, an expert in adolescent mental health, says it's time Nova Scotia bring in trauma-informed care. It's her top recommendation.
That would involve understanding from that young person, what things are difficult for them, what things trigger them.
Davidson says this kind of care results in fewer situations where patients have to be restrained or put into isolation. Both happened to Rehtaeh Parsons. The health minister says trauma-informed care has his support.
It's a strong report from the department and the ministry and our government. We're accepting all 14 recommendations.
Canning's hope is that what happened to his daughter won't happen to another patient.
It's trauma-informed care, rather than re-traumatize somebody or re-victimize them, and those are what I would use to describe that. That had a big impact on her. That hurt her very much.
Now, the IWK says it's introducing training to implement trauma-informed care. However, it says it is still possible that what happened to Rehtaeh, with male workers being present while her clothing was being removed, could happen again, but that would be the exception and only in emergency cases as it tries to implement trauma-informed care. Amy?
All right, thank you for that, Elizabeth. Elizabeth Chu, live in our newsroom.
Just seems like, a reason this week maybe to feel better.
Glenn Canning said he felt uplifted after going through the latest review of mental health and addiction services in Halifax. The review pointed at challenges like barriers to accessing services and offered recommendations like providing patients and families with a system navigator.
That improve access because people are confused. There's a number of programs available, but people don't know exactly how to get to them, so they need some assistance with that.
It's unfortunate it wasn't there all along, but now, we're looking ahead, and I think that's going to be really important.
Another recommendation is to fully implement trauma-informed care for patients who, for example, suffered the effects of bullying or sexual assault.
I think that was really important, and that would have, I believe, would have been very helpful in our case with Rehtaeh.
Rehtaeh Parsons died earlier this year after a suicide attempt. Her family says the Cole Harbour teen was sexually assaulted and then bullied after a photo of the alleged assault was spread around her school. Today's report was also welcomed by the president of the IWK's Health Centre.
We can always improve, and I think that's what Dr. Davidson has said, and she has pointed in the direction of some of those improvements that we're very glad to follow up on.
The province's health minister says his government will also be following up. He's approved all 14 recommendations in the report.
A number of them are definitely going to take years to bring in.
Still, Canning says he's confident this report will make a positive change in the lives of people with mental health issues.
We haven't had a lot of things to celebrate since Rehtaeh's death, But today, I do feel uplifted today. And,
Maya Aswad, Global News, Halifax.
Mental health and addiction services for young people in Nova Scotia points to challenges in recruiting doctors and at some gaps in delivering service. Those services were examined following the death of Rehtaeh Parsons earlier this year. CTV's Jacqueline Foster has been looking into the report, and she's live with more for us tonight. Jackie.
Well, Steve, most people we talk to agree this is a thorough report with very specific recommendations. Some are costly, many are complex, and everyone seems to agree they'll make a difference.
I felt really positive about it.
Glenn Canning likes what he sees in the report examining mental health services for young people at the IWK and Capital Health.
We haven't had a lot to feel good about since Rehtaeh died, but today I felt a little bit different. You know, I felt that it lifted my spirits a little bit today.
His daughter Rehtaeh died in April. The 17-year-old was taken off life support after attempting to take her own life. Today's report doesn't address Rehtaeh's situation, but focuses on treatments as well as policies and procedures. It outlines challenges, including recruitment and retention of clinical staff and physicians, gaps in the delivery of physical services for 17 to 19-year-olds, and sharing resources and information between departments. The head of the IWK admits recruiting adolescent psychiatrists and social workers is tough.
These are highly specialized people. There are not a lot of them around. We're competing across the country.
The report's author says one of the biggest priorities should be a holistic approach to treatment and trauma.
Implementation of trauma-informed care is a culture shift. It requires a review of policies.
Another recommendation deals with continuity of care, patient mapping.
But it's almost like an actual roadmap to your treatment and for your care. We didn't have anything like that. I mean, with Rehtaeh, you know, we were left wondering day to day what's happening, what's going on.
We're accepting all 14 recommendations.
But Health Minister Leo Glavine admits some could take years to implement.
Having been there with a family to grieve at a suicide touches me very personally, and I will be personally disappointed at the end of my time as minister if we haven't made good steps forward.
Glenn Canning believes these changes would have made a difference for his daughter and will help in the future.
Particularly young women who've been sexually assaulted are going to get a different kind of help now, and that's a very welcome change.
Jacqueline Foster, CTV News, Halifax.